Neurological physiotherapists is explaining for itself. They focus on neurological problems, which may include stroke, Guillain-Barré syndrome, multiple sclerosis, Parkinson's disease, those kind of conditions, all those kind of conditions in neurology.
Gucci, Gucci, Louis, Louis, Fendi, Fendi, Prada. Them basic bitches wear that shit, so I don't even bother. Gucci, Gucci, Louis, Louis, Fendi, Fendi, Prada. Them basic bitches wear that shit, so I don't even bother. Gucci, Gucci, Louis, Louis, Fendi, Fendi, Prada. Them basic bitches wear that shit, so I don't even bother. Gucci, Gucci, Louis, Louis, Fendi.
What's good, T-GAANNG? It is your girl T. Welcome back to my YouTube channel. If you are new to this channel, please don't be shy to smash the subscribe button down below and hit the notification bell to see videos every single time I post, baby. Today I am back with another educational video. If you see me in my scrubs, just know that we're about to talk about physiotherapy. So today I'm going to be telling you guys about the different types of physiotherapists, or let me say specialists, physiotherapy specialties that are available. So many people always underestimate physiotherapy. When you hear physiotherapy, you think, I don't know what you think, but then I know that it's superficial. You think superficially about us. Anyway, let me educate you guys on the different specialties in the field physiotherapy. The first specialty in physiotherapy is cardiopulmonary. So these are cardiopulmonary physiotherapists. What do they do? Mostly they work in ICU. Mostly it's in ICU, where we have our patients with heart and lung illnesses. So it can be a patient with lung or a heart illness, or a patient that you see after experiencing a surgery, because they'll be lying in the hospital bed for a long time. They had anesthesia, so obviously they're going to need physiotherapy because secretions accumulate in their lungs. So they'll definitely need a cardiopulmonary physiotherapist to clear up their airways. We use manual techniques in this specialty. Mostly it's manual techniques of the chest, where we can use vibrations. They use percussions. They use shaking, where you help the patients to excrete those secretions, to take them out. So mostly we see patients with maybe cystic fibrosis. You can see patients with bronchitis. You can even see patients with cardiac arrest. So these are the kind of conditions that you'll be seeing, and the types of manual techniques you'll be using that I mentioned above. So this is the first specialty in physiotherapy. Then the second one, we go to a pediatrics physiotherapist, a pediatric physiotherapist. So what is a pediatric physiotherapist do? So as you know, pediatrics is children. So this is a physiotherapist that is trained to work with children. What does this physiotherapist mostly face, or what do they come across in their field? So mostly it's children with developmental delays. Let's say a child is expected to be walking at 12 months, which is 1 year, and then the child is not walking yet. So your physiotherapist comes through and they assist the child with reaching their milestones. So mostly they see developmental delays in children. They also see cognitive conditions. These are the conditions that the children are born with, maybe torticollis, maybe cerebral palsy, those kind of conditions. So that is specialty number 2. Specialty number 3 is the most common one, not to the people out there, but then to us as physiotherapists, is the most common one, and it's the one that most physiotherapists desire to expand into. It's most physiotherapists' passion. So this is a sports physiotherapist. So what does a sports physiotherapist do? So they work with individuals, because every individual have their different needs that they need. So you find out that these sports physiotherapists, they usually work in for a team. Let's say maybe a football team, a netball team. So they work with athletes, right? So what are they doing with these athletes? So mostly you find out that athletes, they get injured mostly. So if physiotherapist then comes in handy. They help these athletes to go back to the normal functioning that they were before they got the injury, so that they can go back into playing their sport. This is done through rehab. We use principles for helping these athletes until they go back to playing. A physiotherapist is needed, and we treat individuals individually because they have their different needs. So we have to push them to reach their peak level of functionality, and we also identify risk factors, if I may say, that may furthermore reach into which may cause injuries when they're playing. So these may be missing components, maybe muscle weakness, things like that. So we focus on those things, the missing components that may endanger our athletes to getting injuries. So that is a sports physiotherapist for you. Then we have geriatric physiotherapists. These people, they work with the elderly. They help the elderly to meet their highest level of independence. So they help the elderly to maintain a very functional lifestyle. Even, you know, when you're old, age comes with a lot of complications, physically, especially emotionally. So as physiotherapists, we deal with the physical. So we deal with the physical component, their physical needs. You have to meet their physical needs. So you help them to maintain as much of a physical lifestyle as possible. Get them working, you know. This is what geriatric physiotherapists mostly do. Then we go to orthopedic physiotherapists. So these are the most common ones that people know, if I may say. Most people, when they hear physiotherapy, they think orthopedics. Orthopedic, it's mostly helping people with musculoskeletal problems. So this involves muscle weaknesses, decreased ranges of motion of the joints, things like that. This is what orthopedics is all about. So mostly the techniques that are used in orthopedics is we can have joint manipulation. We use myofascial release or massage, the common term that you guys know. And this is where we mostly do exercises, electrical stimulation, where we can use TENS, we can use ultrasound, and then we also do heat or cold therapy, depending on if the pain is chronic or acute. Then we have neurological physiotherapists. Oh my god, this is my favorite. This is my passion. If I'm to study further, I'm going to study neurology. So neurological physiotherapists is explaining for itself. They focus on neurological problems, which may include stroke, Guillain-Barré syndrome, multiple sclerosis, Parkinson's disease, those kind of conditions, all those kind of conditions in neurology. It focuses on that. And what mostly do physiotherapists do? What is their role in neurological problems? Mostly we try to treat balance, coordination, and motor control, as well as trying to improve the activities of daily living of the patient. So we want to push them to their maximum level of independence, which is always the main aim with physiotherapy. Then we have what we call clinical electrophysiotherapists. I don't think this is really common in South Africa, but however, in countries like America, it's very common, clinical electrophysiotherapists. So these physiotherapists mainly use electrical therapy to help patients. So they're helping patients mostly with stubborn wounds, maybe those patients with diabetes, they've developed sores. We have burns patients, they have wounds, as well as after amputations we have patients that have wounds that are healing. So clinical electrophysiotherapists come in where they use their electrical stimulations to help the patients in wound healing. And then we have what we call aquatic physiotherapists. Aquatic is water. So this physiotherapists mainly treat patients in water, in swimming pools. Oh my god, my dear black sisters and brothers, I'm not racist, but we know ourselves. Most of us can't swim. I can't swim. So I definitely wouldn't be an aquatic physiotherapist because damn, I'm gonna drown with the patient. But anyway, these physiotherapists treat their patients in water. They do all their techniques, the rehab in water. I don't want to lie, I'm not really informed on aquatic physio. I'm not really informed, and I've never been really interested in it. But then I guess I'm gonna have to find out more about it. Who knows, maybe I might like it. Then we have physiotherapy in women's health. I don't know what they call those physiotherapists, but then they are in women's health. So what are they doing in women's health? They usually help women who have pelvic pains. They have incontinence. Usually incontinence comes after childbirth or during pregnancy. And then sexual dysfunction. So they help women with sexual dysfunction, pelvic pains, as well as incontinence. We use exercises to retrain the pelvic muscles. Some people would like to believe that there are different kinds beyond the ones that I've spoken about. It all depends on your passion, so you can always branch into anything you would love to do. Physio is so broad. There's a lot you can do in physiotherapy. So I hope this video was very educational. I hope you enjoyed the video. Please give this video a thumbs up. If you're coming past this channel for the very first time, then subscribe to my channel and join the T-GAANNG. And please leave your comments down below. Share this video with your family and friends. And I'll see you in my next video, guys. I love you so much.